Hi everyone. As my patients all know, I'm quite keen on breathing. I think it's very important, apart from staying alive obviously. But being and how you breathe is really important. We have two types of breathing. We have our shorter, shallower, day-to-day breathing, and then we have our deeper exertion style breathing. But really the diaphragm is a very important muscle. It's huge. It's more than capable of doing the job for us. So what we need to do is get into a little bit of training to get our diaphragm to work a bit more, so that we don't end up with this kind of short, shallow, ineffective and inefficient breathing pattern. So what I want you to all do today is we're going to try and do some diaphragm releases. So when the diaphragm, it's a dome-shaped muscle, and when we breathe in, it flattens and sucks air into our lungs. When we do shorter, shallower breathing, we tend to use these upper neck muscles to do short, shallow breathing. So we want to try and use the lower rib cage as the guide to get the diaphragm to work harder. So when the diaphragm descends and flattens, actually our lower ribs get pushed out in what we call a bucket handle movement of the rib cage. So we're going to try and encourage that today. Now ideally you can do this standing, or you can do this lying down. Sitting is the hardest way to do this, because when you're sitting you've already pushed your stomach contents right up underneath the diaphragm, so it makes it have to work even harder. So if you're brand new to this, first of all try doing this lying in bed, have a pillow under your head, and then your whole body will be relaxed. Otherwise try standing. So we're going to put our hands on the lower rib cage. To find that, you need to find the edge of the rib cage and follow around, and then just put your hands so you're slightly on the abdomen and slightly on the rib cage. You don't want to be too central, or you're not going to feel that lovely bucket handle movement. So you want to come slightly out. Right, and then try and relax your shoulders. You shouldn't have them up here already ready to do this exercise. They should be nice and down and relaxed. So when we breathe in, I'll show you how not to do it first, okay? So when you take a big breath in, don't do that, because then all you're doing is using these muscles again. We're trying to stop using them. So your shoulders should not really move onto the rib cage again. Right, so I'm going to take a breath in and focus on really pushing those hands out and back in when I breathe out. I'm going to do it properly this time and not talk. The secret is take your time. As with all these exercises, never hurry an exercise. You might find it a little bit difficult to begin with, especially if you haven't been using your diaphragm very much. I think you have to really think and focus on your hands, so that your body and your whole mind is really focused on that area, which is again why lying down in bed with your eyes closed is actually often the most effective way to do this. So have fun, enjoy getting that diaphragm to do its job, and see you soon. Take care, have a lovely day.